Good afternoon, everyone. I'm Senator Julie Morrison, and it is my honor and delight to kick off the Children's Health Caucus with this media event today. On behalf of myself, Senator Weaver, Representative Demmer, Representative Lilly, we want to thank you for your interest and for helping us to build more champions for children in the state of Illinois. Illinois has made some pretty important investments in child health, and I think that's evident by the number of children who now are insured. But I believe we can all agree that there is certainly more that can be done. The Children's Health Caucus will be a place for legislators to investigate, to innovate, to collaborate in a bipartisan, bicameral way. We have the same concerns about children and families across the state, regardless of where you live, what your economic story is. This is going to be a very dynamic group that's coming together. When we don't address things that affect children, if we delay in providing treatment or meet some of the immediate needs, it's simply going to be more difficult, if not impossible, to address those more complex problems as the children get older. It really changes the trajectory of what that child's life can look like. And it's also very important as legislators that we deal with facts, with research data, with statistics, with trends. This organization, this caucus, will provide all of that to us. I am delighted to introduce Senator Chuck Weaver to you for his remarks. Thank you for all being here today.
Thank you, Senator, and thank you for asking me to be involved. That really means a lot to me, and it's great to be part of this. I want people to understand there's kind of two parallel paths going here. What you're seeing the kickoff right now is with regard to the Legislative Children's Caucus, but also at the same time there's a collaboration for children's health that's happening. That is focused really on a lot of different sectors across the state, and it's going to be growing over time. But there's three objectives that we're trying to accomplish. First, with regard to early childhood development. Second, with regard to birth through 18, and how are we able to make sure that every child has good social development, emotional development, physical development with regard to health. And then finally, thinking about children, families, and also communities with a word we're starting to use called health equity. And what we mean by that is how we help in each of those three groups to have the best possible health they can have throughout the state. What you're going to start seeing going forward is not only activity from this legislative caucus, but also with that collaboration that I talked about. And they're going to be going out now, gaining support through a lot of different sectors, other agencies to come together to be working on policy. And they'll serve as administrative support to us and also education for our communities. Thank you again for being here.
Good afternoon. I'm State Representative Camille Lilly, and I too am excited to have been asked to be a part of the Children's Health Caucus, along with some dynamic leaders in just basic health for all citizens of Illinois. But today we're going to talk about our children, who are our future, the Children's Health Caucus. It is so important, and we believe that it's unacceptable to have health disparities in our state, and they do exist. And it is so unfortunate that our young people are being the bunt of those disparities. It is true that every child in Illinois deserves a meaningful, quality access to health care. We here with the Children's Health Caucus, along with all of the organizations, along with all of the policy shapers, are looking to do that with a collective eye. Every child should be protected from injury, abuse, neglect, and crime. We have to come together and do that. A Children's Health Council and caucus will make sure that that can happen for our future. Every child who lives in poverty should not have to be concerned about where their health care is coming from. This is what a Children's Health Caucus, I want to call it a council, but it probably is going to do on behalf of these young people that you see here. Legislators have the opportunity to work alongside each of these entities to shape policy that addresses all the disparities of health that I have mentioned and you probably have experienced. We want to use the data, compiling data, that makes the policy the best it can possibly be. Have we done this before? Well, this is a first. We're going to use data and information with the collective efforts to address the children's health concerns in the state of Illinois. Hence, the Children's Health Council. God bless. At this time, I'd like to bring on the partner with the caucus here, as well as my partner in the General Assembly in the House, Mr. Representative Tom Demmer.
Well, thanks, Camille. I'm Tom Demmer, State Representative from the 90th District. I'm not sure what I can add from what my esteemed colleagues have already told you about why the Children's Health Caucus is so important and why we're all so pleased to be a part of it. I just, offer the perspective that as legislators, we're often asked to weigh in and to vote on issues that affect every aspect of people's lives across the state of Illinois. Health is at the center of many of those issues. Health dictates how well a child can learn. Health dictates what kind of opportunities, what kind of challenges a family faces. Health dictates the direction that an entire community can go through about what opportunities can come to that community and what things we can do to try to better their lives and better their outlooks. So I'm really interested in bringing together the types of experts who are here in this room, the folks we heard from last night, the people we'll hear from still here today, to bring all voices to the table and really let us as legislators get a bigger picture appreciation for how important it is that the children of Illinois be in good health and have good opportunities ahead of them.